The shocking killing of UnitedHealth CEO Brian Thompson on a street in Midtown Manhattan has spurred extraordinary public interest in the nation's largest and most consequential healthcare conglomerate. The loudest public outcry has not been over the crime itself, but at healthcare executives who are being pilloried as putting their own greed ahead of protecting our health. A team of stat journalists spent the last 2 years diving deep into how United operates and its impact on the health of Americans. We leave it to other news organizations to report on the investigation into the crime, but we'd like to distill what we've learned about United and why we focused our investigations so singularly on the company. This year, in a series of stories titled Healthcare's Colossus, Stat documented how United has wielded its unrivaled physician empire to boost its profits and expand its influence. The year before, in a series entitled Denied by AI, Stat reporters exposed how United used an unregulated algorithm to override clinicians' judgments and deny healthcare. These stories highlighted the dangers of AI use in medicine. Let's turn to Stat reporters Casey Ross, Bob Herman, Tara Banow, and Lizzie Lawrence to share what they've learned about United.
UnitedHealth Group is the largest healthcare company in America. There's no one bigger. And there's so many different components to it. It's obviously known for its health insurance company, but it has evolved to something much more than that. It is a provider of medical services. It owns physician groups. It owns the pipes for how everyone gets paid in the healthcare system. So United, for all the obvious reasons, is known as an insurance company, but we wanted to highlight that it's so much more than that now. There were other companies that have certainly tried to mimic what UnitedHealth Group does. You think about all the major for-profit insurers like CVS Health or Cigna or Humana. But what makes United different is they do it at a scale that nobody else really does.
The company is so large and has so many different tentacles that affect care and the delivery of care. I think a lot of people don't necessarily realize that UnitedHealth Group owns Optum. UnitedHealth Group owns Change Healthcare. UnitedHealth Group, very likely in the market that you live, owns a provider or two. And some of these are the largest providers in these markets. When you have one company standing on multiple sides of transactions in this way, in communities all over the country, you have a colossal organization that is able to impact care and the delivery of services in ways that people may not realize.
What have you found is United's reach in terms of American healthcare?
United is a household name in insurance. You see the UnitedHealthcare on your insurance card. And again, that's how most people might interact with it. But they might not see the Optum side. And that covers everything from providers, surgery centers, technology, consulting, revenue cycle, all these little bits and pieces that are just operating the machinery behind the scenes. And that part of United itself is massive.
You went through documents, you got you went through reams of data, you got people, practitioners to talk to you. How hard was that, and how did you go about it?
I reached out to people from the East Coast to the West Coast to Texas to Michigan on LinkedIn, and a lot of them, I found out right away, were very hesitant to talk. They were very scared of litigation. Many of them were under non-disclosure agreements, meaning for a certain number of years after leaving the company, they're not allowed to talk or they'd be threatened with a lawsuit. And several folks told me that United is very litigious and will follow through on that. So those that did talk, many of them would not use their name in the article. Some spoke on background, which means that we could use quotes, but not their names.
One thing you said that you picked up on was the culture at the company. What for people who worked there at the time, what did they say stood out about the culture?
Extremely metrics driven. what people have told me is that everything gets measured, everything has a number attached to it. There's a big focus on productivity, there's a big focus on ROI. I would also say one thing that really strikes me about United Health is that from the very beginning, it has had a succession of very ambitious leaders, men who had almost a single minded focus on growth. One of the executives that I met with was a longtime United Health Group executive. He worked with former CEO Bill McGuire, and he said McGuire was always sort of, as he put it, challenging him, like trying to make him a better executive. And one thing he said that kind of has stuck with me is that Bill asked him one time, why aren't we in Japanese markets? Or what about HSAs? So I just think that mentality of finding new ways to grow is just something that we see in the company today.
Casey, let me ask you about your reporting on insurance denials and how their whole strategy affected patients.
What we noticed was that UnitedHealth Group had acquired a company called Nava Health, which makes an algorithm that predicts how long people who are in rehabilitative care need to stay there to recover from serious illnesses and injuries. These are older people who have suffered things like strokes and broken bones, suffered in falls. They might have cancer or other very serious illnesses. And they were applying this algorithm through insurance plans across the country. Not just their own, not just United policies, but policies owned by other companies. And people would have this experience where they would go into a skilled nursing facility after a hospitalization, and this algorithm would predict that they would need 14 or 16 or a certain number of days to recover. And we found that the insurance companies were cutting off their care in concert with the algorithm, regardless of what their condition was. So you had a lot of very aggrieved people who were basically kicked out of the nursing home and were told that they had to pay thousands of dollars out of pocket for their care, which put them and their families in an impossible situation. Large companies like United Health Group, among others, are incorporating algorithms, predictive software, and artificial intelligence into their decision-making processes in ways that are very difficult to understand and are further disempowering to patients and doctors who are subject to the calculations of those algorithms. And one of the most concerning aspects of that we found in our reporting is that when people would ask questions about these algorithms, how they worked, what data they were trained on, how they were being applied, there were no answers. And they couldn't get information about the decisions that were made in order to intelligently defend themselves, to appeal. When an insurance company issues a denial, it's supposed to explain what the rationale for the denial was. And oftentimes those rationales are very vague. It's very difficult to understand exactly why that decision was made. And then when you find out that that decision was made in consultation with an algorithmic tool or artificial intelligence, it makes it even harder to understand that and then to be able to advocate for yourself or for your loved one. So I think we're standing at a very dangerous moment with the use of these tools by for-profit companies in ways that can benefit the bottom line of that company and may end up really hurting patients in the practice of medicine.
I think healthcare regulators are not fully aware of what they need to be doing to make sure that algorithmic tools and artificial intelligence aren't hurting people in varying insurance plans. In our reporting, we saw that the Centers for Medicare and Medicaid Services are trying to promulgate rules to make sure that health plans are doing what they need, what they should be doing, that they're following the laws, that everyone is getting the care that they're entitled to under programs like Medicare. But they are not really doing anything to crack down on the use of these AI models to make sure that patients are getting denials. So I think it's fair for the public to wonder, are regulators making sure that the use of these tools is being regulated appropriately? And I think that's a gigantic open question.
As part of the Healthcare's Colossus series, Stat interviewed physicians who had felt pressured by United to provide unnecessary care in order to make more money from the federal government's Medicare Advantage program. Lizzie, can you talk about how you got some of these practitioners to talk?
So one area that I really honed in on and ended up being a really valuable source of reporting was in Connecticut. This physician group, Pro Health Physicians, that Optum had bought in 2015, and I immediately the discontent that people felt, that these physicians felt, was palpable. We kind of started, and these were folks that had retired from the company, were no longer working there, and folks that had made quite a bit of money from Optum buying their practice. And they felt so strongly that their practices had been had become shadows of themselves, that they were willing to talk on the record with their names, which was very rare. People are very scared of retaliation from United and talking to us.
I would say there was also a sense of betrayal as well, because, these physicians had built up their practice over years and eventually agreed to sell it to Optum. Optum had promised to let the physicians lead, let them continue to do the things that they were doing to manage their patients. And lo and behold, a couple of years after the acquisition takes place, Optum begins to change their practice pattern in ways that really materially, they felt, undermined the care that they were delivering to patients. The way that they were being asked to respond to patients benefited the insurance side of UnitedHealth Group. UnitedHealth Group's most lucrative business is Medicare Advantage. And these doctors were being told and made to schedule more older patients to test them for chronic conditions that supported more revenue coming in on the insurance side. And they felt that that was harming their patients. They weren't able to care for sick patients. They were doing things that they didn't think benefited the patients. When they asked questions about why are we giving this patient this test at this time, they wouldn't get answers that were satisfactory about the reason for the test or the technology that was being used. There was just a great sense of angst and betrayal, and a lot of them decided to leave the practice rather than continue in that way.
Since Brian Thompson's killing, we've seen this outpouring, it seems, from people attacking the CEOs and the healthcare executives. Is that fair, or is it more complicated than that?
I think there's been so much hatred towards the health insurance industry because that is what people interact with the most when they try to get care. They have their insurance card, and over time, everyone's insurance has gotten it's gotten less protective. People's deductibles go up, so people are paying more out of pocket. The amount that people might be getting in their paycheck might be going down because they have to pay more for their health insurance. So everybody's understandably upset with their insurance company because that's what they interact with. That's usually the barriers that provide someone from getting care.
Obviously, this was shocking, but have you been surprised at the rage and anger that's out there against United and healthcare executives?
I think it was surprising to see the reaction that people had in this moment conveyed in this way after this very shocking event. Kind of an awful situation for the company, an awful crime, and the way that people responded to it with resentment and anger, I think, reflects this deep discontent that people have that came out. And I think it's really spurred a conversation, I think, and people are beginning to think more critically about what's gone wrong here.
This resentment from people about the healthcare system to varying degrees has been bubbling under the surface for a long time. I think you kind of had your head buried in the sand a little bit if you were completely shocked by all of this. And it's not to condone any of this, or, there were some pretty heinous things that were said. But people have been very upset about the healthcare system for a very long time. Healthcare basically went unmentioned during the election season. But this has been ongoing really since even the Affordable Care Act went into effect 15 years ago. So to say that like all of this came out of nowhere, I don't really think that's, a logical conclusion based on all this public sentiment that has been around for so long.
With all this anger and misinformation out there, what do you all want the stat audience to know about United? Are there misconceptions you want to clear up?
Well, I think a through line that we can draw back to connecting sort of the angst that we're hearing and the problems that we've reported about is consolidation and the impact of that on the industry. What people are responding to is the fact that they feel completely disempowered by large entities that are controlling their care in ways they don't fully understand or recognize. What they see is they can't get care when they need it. When they can't get the care and they call somebody, they have to wait on the phone for 60 minutes or 90 minutes that they don't have. They end up getting bills with out-of-pocket costs they don't understand. And so they don't want to access services. They don't want to engage with the system because there is this feeling that this one big company that I have to deal with owns my provider. It owns my insurance plan. It owns all of the data about me. It affects whether or not I can get medicines, when and how I get them. So there is this feeling that the growth of these companies, United being one of them, has just impacted care in very negative ways, where the experience is bad and the price is too high.
United Health put out a statement after the shooting declaring that, quote, highly inaccurate and grossly misleading information has been circulated about our company's treatment of insurance claims, and that it approves and pays about 90% of medical claims upon submission. It also noted that, quote, around 0.5% are due to medical or clinical reasons. What's your overall response, just your blanket response to United saying there's been such highly inaccurate and grossly misleading information put out?
I would say that United, if it believes the information is incorrect, that it needs to come forward with more detailed information about its denial rates across services and answer questions about it that the public wants to know. We don't know the answers to these questions because United will not answer them, among other insurers. The only reason that we know about what the denial rates are within this one domain, this post-acute rehabilitative care domain, is because Stat did a story about it and began to raise questions. And then the United States Senate Subcommittee on Investigations did a very lengthy and detailed report reviewing 280,000 pages of internal documents to finally figure out what was happening within that one narrow slice of the healthcare delivery system. It's a very complicated system. There are very differential rates between the different lanes of care in which health services are delivered. We need to know more about that. And when questions are asked, they need to be answered.
Stat has been reporting deeply on United for the past 2+ years. And we've been reporting on United for much longer than that as well. And they have a very tightly managed media presence. They do not really entertain many offers for big public on the record interviews. That's just how they've operated for years. And increasingly, and this might just be more indicative of corporate America in general, but like getting anyone on the phone at all has been increasingly difficult. And I think that does a disservice to what we try to do. It makes it more difficult for people in the public to understand what's going on.
What's the one takeaway from your reporting that you want people to know?
I would say the one thing I want people to know about United is that it's grown into a very, very large organization that stands on multiple sides of countless healthcare transactions that unfold in our country every day. And within that organization, there are embedded conflicts of interest that materially and negatively impact people's experience with care. And overall, I think that consolidation has gone under the radar and misunderstood for a long period of time. I think economists and antitrust investigators have been focused for a long time on so-called horizontal mergers. This is when one insurance company acquires another insurance company, or one provider buys another provider. But what United has done is bought companies in adjacent markets. It's an insurance company that then buys the provider, that then buys the pharmacy benefit manager, that then buys the surgery center. We've woken up under this corporatized version of healthcare that I don't think anybody wants.
I think a perfect encapsulation of this is looking at Medicare Advantage. This is the $500 billion taxpayer-funded program that covers older adults. This is our mom and dad. This is our grandparents. This will eventually be us. More of Medicare is being turned into this Medicare Advantage program, and it is the biggest insurance business for UnitedHealthcare now. Now, the reason why is because there's so much money there, and it's no accident that United is getting vertically consolidated, acquiring providers to help boost some of the profits within Medicare Advantage. To get more money under the Medicare Advantage program, doctors and clinicians need to code the diagnosis of people. So it is much easier to get those diagnoses if you also happen to own or control the providers. So on the one hand, you have the providers coding people, and on the other hand, you have the insurer denying certain claims, which ultimately leads to the benefit of UnitedHealth Group writ large. As an insurer, you much would rather have your own insurance members go to your providers because you're just essentially paying yourself. There are a lot of financial conflicts of interest here, and Medicare Advantage shows the breadth and scope of United's business tactics over the past decade.
I want people to understand the human cost of consolidation and what happens when an insurer owns providers and why that's an issue. And I want people to feel empowered to be more skeptical of who owns their doctor. We said not a lot of people know that United Health owns Optum, and not a lot of people know what, when they see part of Optum physicians, what that means.
What we found in Connecticut, we also found in Colorado, in California, in Washington State, in Oregon, and Florida. It was the same story everywhere. It was providers who were made to practice in ways that benefited an insurance company and oftentimes harmed their patients, harmed taxpayers, resulted in care that didn't serve patients, but that served the profit motive of an insurance company. And doctors in those practices decided to leave them. Patients found that they couldn't stay with them, that they couldn't get the care that they needed. One of the things that I think about a lot when I'm thinking about United and its impact and sort of how it stands is that it's a massive publicly traded company, and its entire motivation, or so much of its motivation, is driven by a need to serve shareholders. And it's just very difficult to serve shareholders and serve patients and the healthcare system at the same time. People don't understand what insurance companies do. Like it's actuarial science. It's the use of math to make decisions to guard against risk. And it's really complicated. And these companies are really smart, and they're really good at it. And they're filled with all these executives that understand this in ways that they don't. And then we're having this huge communication problem where one side just doesn't understand the other in any way, shape, or form. It's been very interesting, the reporting over the last 2 years, to cover the decisions that United makes about care in different venues. In one venue, when we're covering post-acute care and people who are very sick who need more care, it's using an algorithm and consulting with it in order to cut off their care in a way that financially benefits United. Then in another domain, it is diagnosing patients with more conditions and saying that they need more care when it benefits United in another way. When it does that, when it increases the diagnoses and makes people appear sicker and says that they need more care, it is able to get more money from the federal government to cover them. So you see that in both of those circumstances, the one uniting factor is that it's making decisions that make the company more money.
Our reporting in these series is ongoing. That we won't stop. And I think our reporting has already led to some tangible results. You've seen federal lawmakers hold hearings concerned about the use of AI in certain denials among Medicare Advantage patients. You've seen our reporting has led to class action lawsuits against United and other companies concerned that some of these denials in Medicare Advantage are illegal. Our reporting has shown and has led to CMS more closely scrutinizing some Medicare Advantage plans. And in fact, the federal government is now looking into vertical consolidation. It wants the public's feedback on whether this is a good thing. And most recently, you've seen the top antitrust official at the Department of Justice sue to block UnitedHealth Group's most recent acquisition of a large home health giant. And in fact, he gave a speech concerned about the vertical integration of companies like UnitedHealth. So I think it's clear that lawmakers and federal regulators are waking up that this is an issue and a potential problem for patients. And I expect that this will continue for some years to come.
I think one of the great things about this moment is that finally lawmakers and federal agencies are taking a look at the issues that we reported about, and they're looking at UnitedHealth's role, its structure, and its impact on all of these different groups of people, on patients, on employers, on doctors, on the communities in which all those entities operate. And they're looking at how United has impacted the way that the healthcare system operates and how it's negatively impacting a lot of those parties.